Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and/or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Hello and welcome back to Grounded. Today's win of the week is by Bethany. She says, "Hey everyone, I just wanted to jump on and give everyone a bit of positivity. In September of last year, which is 2024, I went into chronic migraine. I was in and out of the hospital, couldn't walk without an aid, couldn't eat for days at a time, lost nearly 2 stones in 6 weeks, and was unbelievably poorly. This week, I've completed my first week of training for a 5K run. Finding this group, Vestibular Group Fit, in January has been a godsend. I genuinely do not know where I would be without it. Having a community of people to understand what you're going through as well is a huge bonus. Now, don't get me wrong. I'm not yet back to pre-migraine, but I can function well enough that I can do everything I want to in moderation. And I know that at some point it will probably kick my ass again. But I am hopeful with all the tools this group provides that I'll be able to manage it better. This disease does not define you, and you feel this disease does not define you, and the way you feel right now won't be it forever. You will get better. Thank you so much for this life-changing group." And it shows that she has done 3 runs for week one of her um, 5K training. I love this so much because this was posted July 27th, 2025. So it's been about 6-ish months since she has joined group. And she's like, yeah, it's not, or 7, I guess. It's not perfect. Like this takes time, and being able to do more things in moderation is such a huge and positive jump. So I don't want people being like, well, she can't do everything perfectly yet. No, that is not the point. The point is, hey, my mindset has shifted. My ability to walk without aid has shifted. I'm not in and out of the hospital all the time. I can eat again. Like I've gained the weight back that I had lost so much of. All of these things point towards healing and feeling better and being better. And I know Bethany will just continue to get better and better and better. I know that when you're listening to this, it is quite far after she posted, but congratulations to Bethany. Hello and welcome back to Grounded. I have Dr. Emily Kostelnik here with me, who I think this is your third or fourth time being on this podcast. I
Something
appreciate you
like
coming
that.
back.
Lost track.
Lost track. Um, but today we're here to talk about mindset things and a cool new course that Emily is coming out with. But maybe we could first talk about why mindset matters. And if you haven't gone and listened to the other podcasts that Dr. Emily is on, I highly recommend them. I can link them below in the show notes. But why does it matter? Why does the way you think about your symptoms matter for having a vestibular disorder?
Good, very good question. So, for those of you who have followed me and Dr. Madison for any length of time, you know we think about things very holistically. Nothing exists in isolation in the body, and your mindset and your nervous system are no different. And so, when I was new to this, I was very much like, look in the literature. Vestibular disorders plus CBT equals better outcomes. And as I kind of got into it myself as a patient, working with other patients, I was like, why isn't this landing the way that I thought it might, or the way that I've seen it work with other populations? And so I've dug deeper and deeper and deeper and realized it takes a completely holistic approach. And when I say holistic, even biopsychosocial is not enough. So we'll talk about this as we get into like my new course, but biopsychosocial, spiritual, environmental. Even your environment is going to impact your nervous system and your dizziness potentially. And so the way it impacts everything is your body is always listening to your thoughts. Your trauma, which a lot of us have, even if it's medical trauma of being kind of kicked around within the system, stays stored in your body. And so these thoughts are trickling down to your body on a cellular level. So it's keeping your nervous system activated. It's dysregulating your cortisol and adrenaline and norepinephrine, kind of the stress hormones we think of. That dysregulation can lead to chronic immune system dysregulation, inflammation, and then it becomes a feedback loop and it's hard to kind of can be harder to intervene on that. It's harder to intervene on things like anxiety and depression when your body is on fire. So that's kind of the short answer to that. And I'm creating this course to kind of bring to the community all the things I've learned, mostly from a nervous system perspective over the past, I guess, 8 years since I was first diagnosed with superior canal dehiscence, but really since I started working with this population was more like 2021 or 22. So,
Yeah. We have the exact same timeline of when this
yes,
all started to
we
happen from a
did
work
meet
perspective.
pretty early in the Instagram days.
Oh my gosh. I Yeah, that was a really long time ago.
I know. I know.
I appreciate that explanation, and it's important to recognize that, like, yes, biopsychosocial, so biology, psychology, and social things all matter for dizziness, but also your environment. And we've talked a lot about this in the vestibular virtual summit last year, which we're also having next year, which is not what we're talking about today. But environment really means all of the things around you. And I want to make sure everyone knows that, because I think we think like my environment equals how hot it is outside or how cold it is outside or whatever it is. You know what I'm saying? But in reality, it's the people you surround yourself with. How
Mhm.
yes, is it hot or cold outside? What is the weather? But like, also, do you have mold in your house? Do you have a lot of toxic relationships? Like, all of these things matter as well. And I think it's
Mhm.
important to think about not just the literal environment outside.
Cor Correct, yeah, and I think the spiritual piece comes in, and that's something I've more, like, newly gotten into. We know I mean, I've known about this data forever. People with spiritual, religious beliefs even, um, finding meaning, kind of making more sense out of what life means, those people tend to cope better with chronic illness. Like there's a lot of research on that. And so I've tried to put like kind of put the pieces together on that and put this into this course as well. And that might be how do you connect? How do you connect with other people? Do you believe in a higher power? And I'm not saying that you have to, like this looks very different for people. Is nature your point of spirituality? Et cetera, et cetera. Are your values your point of spirituality? So thinking of things on a greater like life meaning, if that makes sense. Um, yeah.
Mhm. I totally agree. So, if people are having a hard time with dizziness, with the way they think about their symptoms, which I feel like many, if not most people with vestibular disorders, especially as you first get diagnosed with this, um, if you are having trouble with your mindset, with thinking about this, what are maybe one or two easy things you can do, which are never actually that easy, but easy in
Mm-mm.
concept, that you can do if you're having a flare or a bad day, or even just a random Tuesday where things maybe aren't even so bad?
Yeah. So I think the thing that's missing from a lot of therapies things like CBT, even ACT, which everyone knows I'm a big fan of, those are called top down approaches. So those are cognitive approaches, which there's definitely a place for that. That would be more of like the mindset piece. But then there's also the bottom up approach of like, what is going on in my body? Is there trauma stored in my body? How do we diffuse that? How do I become more comfortable in my body? And I think there's some kind of misunderstanding about what somatics means. It's someone asked me about this the other day of like, is avoiding things, is that somatic? That's more like a behavioral activation sort of issue. Somatics is more about interoceptive awareness, understanding bodily sensations, and finding safety in your body. Because becoming confident in your ability to withstand sensations, distress tolerance is really, really important as you go through different treatments. Namely, I can't tolerate any foods that I add back in. Somatics is really important for that because we need to be able to ride that wave of things that come up because they're going to come up. Anything new in a body that's on fire and cranky, you're going to feel some new sensations, and we have to be able to kind of ride that. Same is true with new meds. I see all the time, I can't tolerate any meds. And so people end up in this super stuck state. They feel like a shell of themselves or not sure what to do next. And so I think really the top down cognitive, bottom up somatic approaches are both really important. So, kind of the two things I can think of to try today from a cognitive perspective is just interrupting that thought loop because we tend to engage in the same thing over and over and over, whether that's what am I going to do about this? I'm not going to live a whole life. I'm not going to be able to be a mom. I'm not going to be able to work, drive, et cetera, et cetera, et cetera. Um, so interrupting those thoughts, you might see a stop sign, you might say cancel, you might say unhelpful, and you might come back to your five senses. So that might be focusing on an essential oil stick or putting your hands on your steering wheel and feeling that or feeling your back against the chair. From a more somatic perspective, I feel like body scans are helpful. Even some place to start that's really small is focusing on a neutral sensation in your body. All of this might sound super easy and like, how is this possibly going to help me? Repetition. So, the interrupting of the thoughts, repetition, absolutely crucial. From a body perspective, when you have a history of trauma, coming into your body at all can be very, very difficult. So, working with trauma informed people, having that compassion for yourself around like, this is going to be difficult is really important. So, yeah, those two things interrupting your thoughts, coming back to the five senses, and then from a somatic perspective, even being able to put your attention on a neutral sensation in your body, because a lot of times with trauma, which again, all of us have some level of history of trauma, some maybe more than others, putting your attention on your body can be perceived as very unsafe.
Mm. I totally agree. I love those too. I think I was talking to someone the other day about their sensations in their body and symptoms and attacks and all these things. And they're like, well, every time I try something new, it makes me worse. Like I try new breathing, I try a different way of moving, I try to do whatever.
Mhm.
And every single thing makes me symptomatic. And I think that, well, I know that where I sent her to a trauma informed person and all these things, but ultimately, one thing that did end up helping was finding something neutral or just focus on the fact that you are breathing. Like you don't always have to change to do a 4-4-4 breath or figure out, I don't know, how to do a physiological sigh or a deep breath or whatever it is. You just be like, yeah, I am breathing right now and just bring yourself back into your body. I love that approach. I think it is so
Yeah.
important and really, really helpful, even if it feels simple or silly.
Yeah, and I think as you were, like, saying all that stuff, like, my therapist brain was kind of turned on around, like, the language that you were using is problematic. Even the word symptom, like, we have an entire schema in our brain of associations with every single word, even, like, the more neutral kind of words. So, symptom, what does that mean? That's lighting up your brain, that's lighting up your nervous system, that's creating that vicious cycle. Um, what else did you say? Every new thing that someone introduces causes symptoms, expectations around that. Like, I know I've been pretty open about, like, being on a super restrictive diet and adding foods back in. That hasn't been without bumps, and it is 100% to be expected, and creating, again, that sense of safety and not making meaning, not creating a narrative, not creating expectations around what those sensations mean. Um, so yeah, I mean, we see a lot of the same people, a lot of the same kind of patterns. And so I really wanted to bring this course with all of the nervous system things that I've learned over the past however many handful of years. And it's really going to be different than any other course that people have seen from me. Pieces Of course, similar because we can't
Mhm.
like 100% reinvent the wheel, but a lot of new content.
So your old courses are going away, and then you're bringing in a new one, and when is the first one launching? Just so people know, I know people are gonna
Yeah.
ask.
Yeah. So my old courses are all going away. I wanted something like centralized so that as I learn new material, I can just add it to the same place and I don't need to create a new course. And I wanted, with everyone's feedback, short videos, bite size, so you can listen to them. I know for me, like when I've taken courses, I listen to them like a podcast. So I'll like be in the car or on a walk, and bite size can be really helpful. So it's going to be 12 modules with a bonus module. It is going to be called Back to Balance, the whole approach to chronic dizziness. And I'm going to have kind of a free webinar on what the whole approach means in September. So if you want to keep kind of up to date on this, backtobalancecourse.com is where all of this stuff is going to live. So, in terms of what it's going to look like, we'll talk about what the whole approach means. We'll talk about triggers, meaning why am I dizzy? Think things super related to the nervous system. So, of course, I'm going to talk about the things I usually talk about, like environmental, but also like personality patterns, self talk, inner narrative, healing and mindset expectations, cellular and systemic response. Trauma is going to be a huge part of it. Identity, self concept, spirituality, we're going to talk about nutrition and supplements. People ask me all the time, what do you think of Heal Your Headache? What do you think of low histamine? What do you think of this? What was helpful for you? And I feel like now that I'm like kind of on the other side of all of that chaos, I have a bit more of an objective opinion on it since I'm not so stuck in it myself. So, talking about what I think of those things. What situations are they are they appropriate? What situations are they not appropriate? How do you reintroduce foods without having so many waves? The role of the nervous system, regulating the nervous system, again, from a both top down and bottom up approach. We're going to talk about personal identity and values. And what do I do from a nervous system perspective in a whole host of situations that I get asked about every day? Reintroducing foods, meds, supplements, social situations. What do I do if I'm embarrassed about my symptoms? What do I do if family members are asking me and I don't want them to? What do I do at work? What do I do driving or being a passenger or walking in the dark? Like all these things that come up from a nervous system perspective, this is how we might intervene on those things. And then alternative therapies that I've started looking into myself that are kind of more off the beaten path. So things like homeopathy, light therapy, visceral manipulation, fascial release, NAET, like things that are not super discussed very often, peptides, Chinese medicine. And then the way it's going to work is it's going to be different than my other courses, at least to start. It's going to be open doors and then closed doors. So I want to have a cohort of people going through this together. So the doors are going to be open until some point in October. Not exactly sure on the date yet, probably early October. We're all going to go through the course together, which means you will have access to the modules week by week. And so after, say, module 1, you can put questions in, and I will have a private podcast within the course to answer your questions, kind of like this. So it's not live, but it's asynchronous, but still video, if that makes sense. And then we will kind of go through the course together in that way. I anticipate the course will take people probably about 4 months, but you will have access to the course for 6 months. If that's not enough time, you can add on kind of month by month. So that is the general gist. I don't know if you have any specific questions about it.
No, but I really do like that people are gonna be going through this at the same time.
Yeah.
I think that's a really good idea and something that I think everyone is gonna find really helpful, especially from, like, a nervous system standpoint. I know there's nothing out there like this. Like, obviously, in group, we talk about nervous system. On Instagram, you and I both talk about how important the nervous system is. I know that other people mention it online on different platforms, and it can be hard to kind of find, like, an all-in-one these are the things that matter for your nervous system,
Yeah.
which, spoiler alert, your nervous system matters for every single part of that. So I think
It's
that's gonna
true.
be great, and knowing that other people are going through it by your side is gonna be awesome.
Yeah. I think that we heal in communities. I think co-regulation
Mhm.
is a big piece of this. And I
Mhm.
think having a standalone course can be difficult in terms of motivation, obviously,
Mhm.
but then also feeling kind of like on your own. And so
Yeah,
having like a cohort of
definitely.
people, I think will be helpful. The other thing that I think will be different about this potentially than other programs is it's in a specific order, and I'm being very intentional about that. And I think, yes, people are like, well, can I find a lot of this information online? A lot of times, yeah, but you don't know the source, number one. And people come to me all the time with these things they've seen online, various places. It could be stuff like breathing or like really basic stuff, and they're not implementing it correctly. And so that's part of the problem too. So, proper implementation, trustworthy source, and a specific order, if that makes sense. And bottom line, people are like, well, I don't know which program to pick. I think in a lot of cases, you need to have multiple specialties on your team. So, like you with group fit, having someone who's the expert in the movement piece is different than someone who's the expert in the mindset piece. Our training's different. And so I think that those two things will coexist really nicely together too.
I think that's such a great point. Like, it is so easy to get all of this information online from ChatGPT, from wherever. It's, again, easy to get that information. It is not necessarily the right information and the right information for you.
Mhm.
And I think that is such an important thing to think about because just like you were saying, I get very similar DMs that are like, "I've been doing this and it's making me feel worse." And I'm like, "Hey,
Mhm.
here are the 17 reasons why this is making you feel worse." Like,
Mhm.
there's a specific way to go about this, there's a certain way to scale every single thing in the world. There are definitely things to consider for each and every specific person. So making sure that when you are using information from online, that someone is there to kind of back you up and say, yeah, this is maybe what's better for you versus what's better for Jane over here is going to be something that's absolutely essential. So I love that. I love that you're doing like asynchronous question, answer, video, all the things. So I think that's great. I can't wait to see the course.
Yeah. Thank you.
Yeah.
So, yeah, so everything will be at backtobalancecourse.com. Or of course, you can message me on Instagram at Dr.
Hmm.
Emily Kostelnik. And I'm super excited. And this like initial launch is going to be really, I don't want to say beta testing because I think it's going to be like more complete than something that's
Hmm.
being beta tested, but
Hmm.
it's going to be a great opportunity for this cohort to give me a lot of feedback and like help the course kind of evolve over time. And again, it's going to be really hands-on with a lot of access to me, tons of meditations, journal prompts, exercises, like all the things of how do I do this? Not just like the what is it, but the how do I actually do it? That is hard to find online. And the like maybe you know what the breathing exercises is, but how do you actually implement that into your life is usually the missing piece. So,
Absolutely. Well, thank you so much for sharing and for giving us
of
some quick tips
course.
and tricks and things like that.
Sure thing.
Awesome. I can't wait for this course to come out. All right.
Thank you. Thanks for
Bye.
having me. Bye.
Always. Bye.
Bye.